Lisinopril, trusted by over 40 million people daily, has been linked to immune system collapse, skin literally peeling off in sheets, and babies born with destroyed organs. These aren't rare side effects. They're catastrophic medical emergencies happening to thousands of patients every year, buried in fine print while Big Pharma counts their billions. What makes this terrifying is how doctors prescribe Lisinopril as if it's harmless candy. But today, you're going to discover the complete horror story that pharmaceutical companies pray you'll never see, starting with the first side effect of Lisinopril: angioedema. Imagine waking up and not recognizing your own reflection. Your lips have swollen to grotesque proportions. Your tongue feels like a foreign object in your mouth, and your throat is closing. This is angioedema, and it's one of the most terrifying complications associated with Lisinopril use. This isn't just swelling. This is your body turning against itself in a way that can suffocate you from the inside. Studies reveal that approximately 0.7% of patients on ACE inhibitors develop angioedema within 5 years. But what makes this statistic truly horrifying is its unpredictability. Research published in emergency medicine journals shows that angioedema can strike without warning, even after years of safe Lisinopril use. Patients who have taken their medication religiously for months or even years can suddenly find themselves in a life-threatening emergency. The mechanism is as fascinating as it is deadly. Lisinopril blocks the breakdown of bradykinin, a compound that causes blood vessels to dilate and become more permeable. When this system goes haywire, fluid rapidly accumulates in the deeper layers of tissue, particularly around the face, lips, tongue, and most dangerously, the throat and larynx. What makes angioedema particularly insidious is how it progresses. Within minutes to hours, the swelling can advance from a slightly puffy lip to complete airway obstruction. Emergency departments across the country see patients arriving in respiratory distress, unable to speak, with their airways compromised by their own swollen tissue. Second, Stevens-Johnson syndrome. If angioedema is terrifying, Stevens-Johnson syndrome is pure nightmare fuel. This rare but catastrophic skin reaction causes your body's largest organ to literally burn from the inside out, peeling away in sheets like a gruesome molting process. Research published in dermatological journals has documented cases where Lisinopril triggered this devastating condition, turning patients into living horror stories. The syndrome begins deceptively, mimicking flu-like symptoms with fever, sore throat, and general malaise. But within days, the skin erupts into angry red patches that quickly progress to widespread blistering. The most horrifying aspect is watching large areas of skin die and slough off, often requiring specialized burn unit care. Studies indicate that Stevens-Johnson syndrome has a mortality rate of 5 to 10%, while its more severe form, toxic epidermal necrolysis, carries a death rate of up to 50%. The pain is described as excruciating, as patients literally lose their protective skin barrier. Complications include severe dehydration, secondary bacterial infections leading to sepsis, and multiple organ failure. Case studies published in clinical journals have documented patients who developed SJS within weeks of starting Lisinopril. The condition affects not just external skin, but also mucous membranes lining the mouth, eyes, genitals, and respiratory tract. Survivors often face permanent scarring, vision problems, and psychological trauma from their ordeal. Third, immune system collapse. Picture your body's army of white blood cells suddenly vanishing, leaving you defenseless against every germ, virus, and infection. This is neutropenia, and Lisinopril can trigger this immune system meltdown in some patients. Research published in hematology journals has documented cases where patients' white blood cell counts plummeted to dangerously low levels, essentially leaving them immunocompromised. The condition manifests with persistent fevers, chills, recurrent infections that won't heal, mouth ulcers, and extreme fatigue. What makes this particularly devastating is that common infections that healthy immune systems easily defeat can become life-threatening. A simple cold can progress to pneumonia. A small cut can lead to sepsis. Clinical studies have shown that neutropenia can develop gradually or strike suddenly. Patients have required hospitalization in isolation units to protect them from infections their compromised immune systems cannot fight. 4. The unrelenting cough from hell. Don't let the term dry cough fool you. For many Lisinopril patients, this becomes a relentless torture that destroys their quality of life. This isn't a gentle throat clearing. It's a violent, persistent spasm that can continue day and night, robbing patients of sleep and driving them to the brink of madness. Studies indicate that up to 20% of patients develop this characteristic cough, making it one of the most common reasons for discontinuing the medication. What makes it particularly maddening is that traditional cough suppressants are completely ineffective. The cough originates from accumulated bradykinin irritating the airways, not from typical irritants that cough medicines address. Patients describe the sensation as a constant tickle or scratch that demands to be scratched but can never be satisfied. Case studies have documented patients coughing so violently they crack ribs, rupture blood vessels in their eyes, or vomit from the force. The cough can persist for weeks even after stopping Lisinopril, as the drug's effects on the bradykinin system take time to normalize. 5. Liver destruction. While patients focus on their blood pressure numbers, Lisinopril can be silently destroying one of their most vital organs. Though rare, severe hepatic injury from this drug has been documented, including cases of fulminant acute liver failure requiring emergency transplantation. Research published in hepatology journals has linked Lisinopril to liver damage so severe it can be fatal. The mechanism involves direct hepatotoxicity and immune-mediated liver injury. The drug can trigger an autoimmune response where the body's immune system attacks liver cells, mistaking them for foreign invaders. Early warning signs include dark urine, yellowing of the eyes or skin, jaundice, persistent nausea, and abdominal pain. Case studies have documented patients progressing from normal liver function to complete liver failure within weeks of starting Lisinopril. 6. Acute kidney failure. In one of medicine's cruelest ironies, the medication prescribed to protect kidneys in diabetic patients can sometimes destroy them instead. Lisinopril-induced acute kidney injury represents a catastrophic reversal of the drug's intended protective effects. Research published in nephrology journals has documented cases where patients' kidney function deteriorated rapidly, requiring emergency dialysis. The mechanism involves excessive reduction in blood flow to the kidneys, particularly in patients who become dehydrated or have underlying kidney disease. When blood pressure drops too low, the kidneys don't receive adequate perfusion to function properly. This creates a vicious cycle where reduced kidney function leads to fluid retention and further complications. Early signs include dramatic reduction in urine output, swelling in the legs and ankles, shortness of breath, and extreme fatigue as toxins accumulate in the bloodstream. Some patients have progressed from normal kidney function to requiring permanent dialysis within days of starting or adjusting their Lisinopril dose. 9. Mental chaos. In perhaps the most disturbing category of side effects, Lisinopril can trigger bizarre neuropsychiatric symptoms that feel like episodes from a psychological thriller. Research published in psychiatric journals has documented cases of visual hallucinations, delirium, and even manic episodes triggered by this blood pressure medication. Case studies have reported patients experiencing vivid hallucinations, seeing people or objects that aren't there, while others have developed severe confusion and disorientation. One documented case involved a patient developing full-blown mania after starting Lisinopril, exhibiting erratic behavior and mood swings completely out of character. The mechanism may involve Lisinopril-induced hyponatremia, dangerously low sodium levels, which can cause brain swelling and altered mental status. Some patients have experienced seizures and coma from severe electrolyte imbalances triggered by the medication. 10th, fetal destruction. Finally, we come to Lisinopril's most devastating side effect, one so serious it carries the FDA's strongest black box warning. This medication can destroy an unborn baby, causing severe birth defects or fetal death, particularly when taken during the second or third trimester of pregnancy. The drug interferes with fetal kidney development and blood pressure regulation, leading to irreversible organ damage. Research has documented cases of babies born with underdeveloped kidneys, skull deformities, and growth retardation directly linked to maternal lisinopril use. Some infants have died from complications related to in utero ACE inhibitor exposure. What makes this particularly tragic is that many women of childbearing age remain unaware of this catastrophic risk. The medication can cause fetal harm even in early pregnancy, making immediate discontinuation essential once pregnancy is detected. Thank you for watching and supporting our work. If you found this helpful, please give it a like and subscribe for more content like this.